The worldwide quarantine for the coronavirus pandemic or COVID-19 is a fraud.
What's up, Johnny?
All right, man.
What do you know, baby?
You can take out the mask, Doug. The case fatality rate's like 0.1 to 0.3 according to.
Is it really? Wow.
Which puts you right in line with the flu.
Yeah, exactly. That's what it is. So it was a hoax.
I don't think it was a hoax.
So it was a hoax. So it was a hoax. So it was a hoax.
I don't think it was a hoax.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful. Everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
And let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it. If someone dies with COVID-19, we are counting that as a COVID-19 death. Counting that as a COVID-19 death. If someone dies with COVID-19, we are counting that as a COVID-19 death. If someone dies with COVID-19, we are counting that as a COVID-19 death.
You know, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening. You know, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening.
¿Ya? ¿Sí? Buenos días.
What the CDC says in part about how to count COVID deaths. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, it is acceptable to report COVID-19 on a death certificate as probable or presumed. It references the fact that basically this is a judgment call for doctors on how...
The idea that we're going to allow people to massage and sort of game the numbers is a real issue because, I mean, let's just take someone getting hit by a bus and they collapse along and they go into the emergency room and the COVID test comes back positive and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense. We're going to put that down as COVID-19? That doesn't make any sense. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. That if you have a COVID-19 admission to the hospital, you'll get paid $13,000.
Now, this model informed government policy decisions in the U.S. and the UK. Epidemiologist behind highly cited coronavirus model admits he was wrong, drastically revises model. Now the epidemiologist predicts hospitals will be just fine taking on COVID-19 patients. Ferguson also acknowledged that it was impractical to keep the UK in lockdown for so long because of the impact on the economy. Epidemiologist behind highly cited coronavirus model admits he was wrong. Epidemiologist behind highly cited coronavirus model admits he was wrong.
I'd like to start with the question of these models, which are now getting a lot of pushback in terms of their reliability. I think one of the problems is that those models were what were used to shut down the United States economy.
Yeah, well, first, I think it's important to point out that it isn't the model or the result of the model that really led to the decision to have such strong mitigation programs such as physical separation. You don't even have to look at any model. Just take a look at what happened in China. Take a look at what happened in northern Italy, how the hospitals were completely overrun and the draconian methods that had to be taken in China to turn down their outbreak. You just needed to look at China. That's all you needed to do, and see what happened in China. And you don't need a model.
You know, number one, you don't know what the numbers are in China. China does your numbers, and I'm speaking to President Xi tonight, I believe. We'll have a good conversation, I'm sure. But you just don't know, what are the numbers? Number one, you don't know what the numbers are in China. Number one, you don't know what the numbers are in China.
China's testing kits claim to produce the results in just 10 to 15 minutes, but reports from many countries show that the results are far from accurate. China's testing kits, the results are far from accurate.
Now, Italy, very interesting, has been grappling with this same debate for weeks. According to Professor Walter Ricciardi, is the scientific advisor to Italy's Minister of Health. This is what he said. He said, the way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many had 2 or 3. It's that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. It's that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus.
When it comes to COVID-19, there is the additional data skewer that is, get this, there is no universal definition of COVID-19 death. The Center for Disease Control, updated from yesterday, April 4th, still states that mortality, quote-unquote, data includes both confirmed and presumptive positive cases of COVID-19. Translation, the CDC counts both true COVID-19 cases and speculative guesses of COVID-19 the same. They call it death by COVID-19. They automatically overestimate the real death numbers by their own admission.
Our data suggests that COVID-19 has an infection fatality rate that is in the same ballpark as seasonal influenza. It suggests that we have solid ground to have optimism about the possibility of eventually reopening our society and gaining back our lives. COVID-19 is in the same ballpark as seasonal influenza. COVID-19 is in the same ballpark as seasonal influenza.
From Project Veritas here, driving to get the COVID-19 test. The situation itself, is it as bad as ever the media is saying, the whole pandemic?
Oh, no, it's the flu.
It's just the flu.
It's the flu.
That's all it is.
It's the flu.
Wow. Is the media accurately reporting, or is it as bad as people are saying? It's not as bad as the media is making it out bigger. Wow.
Oh, no, it's the flu.
It's just the flu.
It's the flu.
That's all it is.
It's the flu.
Wow.
It's the flu. It's the flu. It's the flu.
A lot of people come to the hospitals over-exaggerating and be sent home because they don't have it. So unfortunately, when you walk in, you say, I think I have, it goes down considered a case. It gets reported to the CDC. So after the numbers.
So the CDC is just telling us everybody who...
Yeah, everybody who walks in the door is complaining of it gets put in as a case until proven otherwise. Yeah, everybody who walks in the door is complaining of it gets put in as a case until proven otherwise.
So I'm here at the Tallahassee Center for Corona testing. But when you go to the testing center, they say there's no order, no need to test. This whole thing is a farce.
And officials say this, unfortunately, is just the beginning, with the crisis expected to last for months and the peak of it all still on the horizon.
Elmhurst Hospital, lines of people outside wait to get tested.
Long lines of people trying to get tested. I don't see that.
A refrigerated truck has now been brought in here, a makeshift morgue.
There's the refrigerated truck for the dead people, but no action.
Ambulances have seen a surge in calls, responding to nearly 5,800 Thursday.
All parked ambulances, no patients, nobody's rushing anywhere.
Supposed to be getting tested, and a big mad show. People look at the testing centres. There is no testing going on. Wake up, people. Right down to the end, look. There is no testing. There is no testing going on.
So many people are dying in New York City due to coronavirus complications that the morgues are crowded, to the point where new graves are being dug off Hart Island near the Bronx.
It's aerial drone footage of what is being passed off as a trench mass grave somewhere in New York. This is, in fact, Hart Island, sometimes referred to as Hart's Island. The remains of more than 1 million people are buried on Hart Island, though since the first decade of the 21st century, there are fewer than 1,500 burials a year. Burials on Hart Island include individuals who were not claimed by their families or did not have private funerals, the homeless and the indigent, and mass burials of disease victims, including those who died from AIDS and COVID-19. So the rather shocking video footage that has now been circulating the internet that some reporters are actually calling mass graves that are being dug specifically for COVID-19 has in fact been the situation for quite some time. I went to YouTube just to search around, and within 5 minutes I was able to find footage from the 1990s of Hart Island being used for this exact type of mass burial. Footage that was uploaded to YouTube almost 10 years ago and which is itself from the 1990s shows inmates digging mass graves for mass burials on Hart Island. And how easily so many people can be misled with information that they find in the news.
The ICU is already overwhelmed.
So we go back to that. Here's, according to ABC on March 20th, this is Italy. And according to CBS on March 24th, this is New York. The same footage from the same hospitals. You got the two doctors, one in green scrubs, one in blue scrubs. And if you pause it right here, see you got the same computer, same wastebasket, same green thing here on the bed. The back's exactly the same. It's the same exact footage. One being used for Italy and one being used for New York.
They actually played the footage side by side, one being captioned Italy and one being captioned New York. And of course the viewers at home caught this mistake.
Forced to buy ventilators from China because it was like bidding on eBay to secure enough in his own country.
As you see, the title here, New York coronavirus cases surge, hospitals struggle to cope, or why would the media resort to using a doll?
Okay, look at the hole in the arm. Look at the hole here. Look at this bulge in the neck, and look at that hairline, man. Closer in again. Look at that hairline. I mean, does anybody actually think that that's real? Oh, no.
Published by the New York Times and created essentially by this one doctor. Let's have a look at some of the video footage.
We are right now scrambling to try to get a few additional ventilators.
Now we're seeing 400 or more people a day. It's a little bit scary now as the patients that we're getting are much sicker. Many of the young people who are getting sick don't smoke. They're healthy. They have no comorbidities. They're just young, regular people between the ages of 30 and 50 who you would not expect.
So let's investigate. Here's her LinkedIn page, Colleen Smith, and oddly it doesn't say doctor. Emergency medicine physician and resuscitationista with interests in simulation. Here we notice that she went to the New York University School of Medicine. She was a simulation fellow, a simulation fellow, a simulation fellow. Her skills and endorsements: medical simulation. It's medical simulation. It's medical simulation. This is a presentation she made that is uploaded onto this site. Here it says simulation. Here it says simulation. Here it says simulation. This P.J. Moore, 1958. That the Twitter bio of Colleen Smith also doesn't say doctor, but it does say simulationista. 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 So she's the one behind this. And all major television and media, print media, spread this story around uncritically. Simulationista. Simulationista. Simulationista.